Hi, my name is Shanitra and I am an RN. And today I want to talk about Nclex questions, which are nursing questions while you're in nursing school. And these questions are hard, they're difficult, but inhale, exhale, it's a way to get through it. So, one thing to help me out through nursing school is knowing the nursing process. And what I would do was, whenever, let's say, for example, before class, print out the PowerPoints, know what illnesses the instructor talks about in class, even though just because the instructor talks about it in class is going to be on the exam. That's no, I'm not saying that, but it's good to know. Also, know what your textbook says about the illnesses. Textbooks are very wordy, so what I also used was the Nclex Saunders. Got straight to the point. ATI was also great, straight to the point. Uh, Probably more reliable, and well, they're both reliable sources. I shouldn't say that, but anywho. So, okay, instructor talks about, okay, so today we're going to be talking about risk conditions related to pregnancy. Okay, awesome. So, for each illness, what I would do is know the assessments. Know, so when I say assessments, what does that mean? What am I looking for in those illnesses? Okay, know the diagnosis. See, nurses can't use doctor diagnosis, so we have to describe what we see. And thirdly, plan slash intervention. Plan and intervention, they go hand in hand. It's basically okay. So you assess the patient. They have this problem. Uh, you describe the problem. It's what's next? What can you do? You need to intervene or and plan and evaluate. Okay, take a moment. Is the patient doing better or is the patient doing worse? And if the patient's doing worse, you got to start all the way back over, back to assessment. So let's practice a question. Okay. Okay. So the home care nurse visits a pregnant client who has a diagnosis of mild preeclampsia. Which assessment finding indicates a worsening of the preeclampsia and the need to notify the health care provider? Urinary output has increased. Dependent edema has resolved. Blood pressure reading is at the prenatal baseline. Or 4, the client complains of headache and blurred vision. Okay, so in order to answer this question, we have to know what are the symptoms of preeclampsia, and that's why it's important to know this. What are you assessing? So, urinary output has increased. Okay, we know that's normal because the baby, um, when a woman is pregnant, that's increased pressure on her bladder. So that's normal. Dependent edema has resolved. That's normal. Because yeah, that's normal. Blood pressure reading is at the prenatal baseline. That's normal. The only thing that's not normal is the client complains of a headache and blurred vision. Okay. Then after that, I will always read the rationales. So in a sense, you are reading because you're reading the rationales. If the client complains of headache and blurred vision, the healthcare provider should be notified because these signs of worsening preeclampsia. Options 1, 2, and 3 are normal findings. And you see how they break it down. They tell you where they got the information from. Nursing process, which is assessment. So I hope that helps. If you want more information about a particular illness or illnesses or diseases, comment below. Maybe I can go through this book and write down some study information. So thanks for watching. Have a great day. You can do this. Nursing school, it is difficult, but it is doable. Pray. You got this. Thanks for watching.